Now, what is the pathophysiology of peritonitis? Once the causative agent enters the peritoneal cavity, the peritoneal cavity responds by exudative response. Alterations in fibrinolysis through the increased inhibition of plasminogen activation. So, fibrin exudate is very important. Now, this fibrin matrix sequestrates the microorganism or the causative agent so that it does not spread through into other parts of the peritoneal cavity. As we said, there is an exudative response. Once the toxin is diluted by this fluid that is outpouring from the peritoneal surface, this causative agents can be carried to the rest of the part of the peritoneal cavity either by respiratory movement or intrinsic visceral peristaltic movement. So, all that can be prevented if they are sequestrated within a fibrin matrix. So, this fibrin matrix helps in localizing the inflammation, avoiding the spread of the disease to general peritonitis. Next step is septicemia, shock and death due to multi-organ failure. The other side of this fibrin is the formation of residual infection or abscesses formation, and that is what we call that tertiary peritonitis. So, the body's ability to localize or prevent the spread of disease depends on the microbiological load, which can overwhelm the defense. Second important component is the virulence of the organism, which can resist the phagocytosis by the neutrophils. So, the virulence of the organism can be because of its ability to form the capsule or its ability to create a facultative anaerobic growth capabilities. As we said, additions. Succinic acid secretion is another point by which the virulence is enhanced. Synergy between the organism like Bacteroid fragilis and E. coli enhancing each other's capacity to withstand the anaerobic conditions. Now, the role of fungus and enterococci together in the intra-abdominal sepsis being investigated. Presence of fungal infection may be the reason for tertiary peritonitis. Cytokines, these are the mediators of inflammation, and high level of some of the cytokines like TNF-alpha and IL-6 have a very poor outcome. Now, what are the causes for peritonitis or etiology for the peritonitis? Microbiologically, it is predominantly bacterial. If it is non-biological or non-bacterial, what are the other causes for peritonitis? Chemical peritonitis, bile, blood, digestive enzymes like biliary, pancreatic or gastric secretions, chyle, urine, barium, glove powder, or these non-biological chemical reasons for peritonitis. Now, the bacterial peritonitis is the commonest one we encounter in our surgical practice. As we said, it is responsible for primary, secondary and tertiary peritonitis.